up, beautiful people? Welcome to the Dr. Joy Show, your prescription for total wellness, and I am your host, Dr. Joy. Today's topic is your digestive health. Yes, I have an expert, and yes, I'm going to introduce him. But before we get started, you know what we do on the Dr. Joy Show. 3 deep breaths. Are you ready? Inhale. Exhale. Inhale. Exhale. Last one. Inhale. Exhale. How do you feel? I know I feel great. Well, without further ado, I want to introduce my guest, Dr. Mark Greaves.
Thank you.
Thank you for joining me on the Dr. Joy Show. You are a gastroenterologist from Digestive Healthcare, right?
Yes, I am.
In Hillsborough.
Yes.
Yes, thank you. So we're going to talk about your digestive health. I want to start out with a fact. And I'm going to read this. According to the International Foundation for Functional Gastrointestinal Disorders, IFFGD, IBS is the most common functional gastrointestinal disorder with worldwide prevalence ranging from 10 to 15%.
Yeah, actually, in this country, it's at least 10%. So that means at least 30 million Americans have irritable bowel. It's by far and away the #1 reason that people come see a gastroenterologist. And so I deal with it every day.
And this is the reason why you're here. IBS is Irritable Bowel Syndrome.
Yes, that's correct.
So before we started taping, you had said something about Rome 4 criteria. Can you tell me more about that?
Sure. So the Rome 4 criteria is what they use in research studies for irritable bowel. It's Rome 4 because the people that voted on this had their conference in Rome, and this was the 4th time they did it. But basically, the current criteria is that if you've had symptoms at least once a week for a minimum of 3 months, including pain, and usually some alteration in how you go to the bathroom. Too much, too little, it's changed in shape, it's changed in texture. That's the basic working definition. But I want to reiterate that that's mostly for research studies as a way to try to quantify it. In everyday life, when I see patients, I don't necessarily try to think, does this meet Rome 4 criteria? You basically just develop a comfort level with the types of people you see, the types of symptoms that they describe, and how to begin to care for those people.
Okay, so we don't talk too much about bowel movements because it sounds nasty, disgusting to people, but it's very, very important, right? Because we're releasing our toxins. So now let's start. What is IBS?
So irritable bowel is overall considered, as you said, what they call a functional disorder.
Right.
And this means that people have legitimate symptoms, and those symptoms can be quite severe, and yet when you go to examine the individual organs, such as the colon or the stomach, either by an endoscopy or a CAT scan or blood work, the tests always come up normal. And the reason for that is because irritable bowel is due to a complex set of factors that are occurring on a microscopic level. And so they break down irritable bowel into several categories in terms of its contributing factors.
Okay.
So the most common factor that we talk about is what is technically known as visceral hypersensitivity, but it really just means sensitive nerve endings or a sensitive gut.
Really?
Yes. And so they've done a number of research studies over the years that have proven that people with irritable bowel have more sensitive intestines compared to people that don't.
Okay.
Some of the research studies are very interesting. Don't ask me why they did this, but at some point they did a study where they took regular people and people with irritable bowel, and they put water balloons inside their back end.
Oh, really?
And they inflated them. And the people with irritable bowel were much more sensitive, felt much more pain at a much smaller size balloon than the people that didn't. So that was one of the earliest examples they had of people being more sensitive.
Okay.
But we've seen this in a number of nerve type conditions: diabetic foot pain, fibromyalgia, chronic migraines. And another example that I sometimes give my patients is, unfortunately, with the wars in Afghanistan and Iraq, several of our armed service troops have lost limbs in explosions.
Okay, yeah.
And you may or may not have heard of the condition known as phantom limb pain.
Yes.
And so that is a condition where people can have burning pain pain in a leg or arm that no longer exists. So if you can start to understand how someone can have pain in an arm that's not there,
Right.
you can start to understand how people can have abdominal pain, and yet when you go to look at those organs, they seem perfectly fine.
Right. Okay.
And so that's one major category. The next major category is that altered motility of the intestinal tract seems to play a role. So that can include spasming of the intestines.
Okay.
It can include speeding up of the intestines, leading to diarrhea.
Okay.
Slowing down of the intestines, leading to constipation. But a lot of times for people with irritable bowel, they'll have some kind of altered motility. Another factor which is just newly being discovered is, again, on a microscopic level, there is some inflammation in the wall of the intestines that seems to be going on with these people. And that's probably related to how their gut and their underlying genetics and their underlying environment factors interact with their gut flora. We all have flora and bacteria in our gut.
Right.
They're supposed to be there.
Right.
But for whatever reason, in irritable bowel patients, that interaction is not as friendly as it should be.
So what causes it?
No one really knows. There is a subcategory of people.
You see my face?
Yeah.
Wait, wait. Let me back up, because you just said something along the lines that 30 million Americans have IBS, but we don't know what the cause is.
Again, I've given you some of the examples of what we believe leads to the condition.
Right.
Why people get this hypersensitivity, why people get a bad interaction with their flora, why people's motility changes, that we still don't know. We don't know what triggers it.
Okay.
We just know what the end result is. We know what causes the symptoms, and it's these things I've described. But for most people, we don't have a trigger. Now, there is a subset of people that are what we call post-infectious irritable bowel. Now, so those people are people that have been triggered to have irritable bowel because of an original stomach bug infection.
Okay.
And there also is a similar group that has been triggered by getting antibiotics for a long period of time to treat a variety of disorders, but that antibiotics seems to trigger in them irritable bowel. And we believe in both reasons it's because there's an alteration between the good bacteria in your gut and that intestinal wall that's been triggered by these events. So but that only is a small subset of patients with irritable bowel. Most irritable bowel patients don't have a clear cause. There is certainly an association with type A personalities and with people that tend to run on the more anxious end of the spectrum. Although I want to iterate, this is not considered to be purely an anxiety disorder, only that there's an association with those types of patients.
So based on the research out there and based on your experience, who gets it? Men versus women, children?
Anyone can get it. It certainly tends to be more common in younger people, by which we mean under age 30.
Okay.
It tends to be slightly more common in women. And again, it tends to be more common in those type A, borderline anxious type patients. I've seen it started for the first time in the elderly. I've seen it start in men, but those tend to be kind of the broader categories. Symptoms, although again we discussed with the Rome 4 criteria primarily abdominal pain and changes in bowel habits, there can exist a large variety of symptoms which can include abdominal pain, and that can be in multiple different areas in your belly.
See, wait a second. You know what? I had a hey Rick, we're gonna keep rolling. Rick, there's a chart out there. Can you bring it, please?
It's lean up against the wall outside. I saw your other producer lean it up.
That's okay.
Did you want to just
do
this part?
Yeah. No, we're not redoing anything. This is time. We're rolling. So this is the diseases of the digestive system. I just want everybody to see that. So here is IBS. So it occurs in here, right?
Well, so this is just a box as an illustrative example. So we believe that most of the symptoms from irritable bowel are generated within the large intestine or the colon, which is what this box is trying to indicate. But the large intestine runs down the left, up the left side, across the top, and down the right side. So people can experience pain literally throughout the entire abdomen based on the course of this large intestine.
Okay,
so that is something to consider. And in fact, when I hear patients that say that they have pain in multiple sites, that makes irritable bowel more common, because otherwise you're going to have to argue that people are having multiple diseases occurring simultaneously in different organs. Their gallbladder, a kidney, or if you're having pain up here or pain here. But since the colon runs through that entire area, the colon would explain all those symptoms. And so when I hear someone that's having multiple pain, that's young, that maybe is female, I start to right off the bat think maybe this is in fact going to be irritable bowel.
Wow. So, okay. So now that we cleared that up, how do you diagnose it? Because I know Rome 4 has the criteria, but what does Mark Greaves say?
So in my experience, if someone comes in and they have chronic symptoms, and yet overall they look like a healthy person coming in the door, that's a strong suggestion it's probably irritable bowel. Because although irritable bowel can cause a lot of pain and problems going to the bathroom, it is not a true autoimmune disease or inflammatory condition. It is not something that turns into cancer.
Okay.
And so ultimately,
Well,
although
that's
these
good.
yes, and so ultimately, although these patients have chronic symptoms, they don't progress in the way someone that let's say had Crohn's disease or cancer would progress. They're not slowly losing weight. They're not malnourished. They're not bleeding. And so most of the times they come in and they look like you or I. They look like people that would otherwise be healthy. You don't look at them and think, wow, that person looks like there's going to be bad news. They tend to be younger. Again, they might have already previously diagnosed depression or anxiety. Again, not that that's the sole cause, but it's certainly an association and a common factor. And then when they start to talk about symptoms, again, they're going to have a variety of symptoms. They're going to have pain all over the place. They're going to have rare triggers. They're going to have all kinds of, they're going to say that they have diarrhea some days and then are constipated the other days.
Oh, geez.
They're going to say, seeing cats gives them heartburn and eating potato chips give them abdominal pain. Symptoms that don't really always make a lot of sense. And so when you have someone that has all these symptoms and yet they look healthy, you have to think, okay, well, what's IBS? It certainly comes into your mind, absolutely.
So, okay, so wait a minute. You said stress, and I say, what does stress have to do with it? But stress has a lot to do with a lot of things.
I would argue that stress is a major influence on our health in general.
Yeah.
No matter what disease you have or what symptoms you have, there's always a certain amount of actual pain that's caused by the disease itself, and let's say that's here. But then your emotional stress over it is going to make it feel like it's here.
Right.
Because the anxiety makes you focus on the symptoms more, makes you obsess about the symptoms, makes you anxious as to what the symptoms represent. You get nervous that you're sick. And so that just always tends to overblow how bad the disease is. So, and I think that's true for any disease. Anyone that's had a long-term illness has a component that's anxiety driven.
Of course.
And that happens to be especially true with functional disorders such as irritable bowel. But again, irritable bowel is still due to nerve endings that are sensitive beyond the patient's control. Okay, this is not symptoms they're making up. It's just symptoms that are leading to anxiety, and that anxiety is worsening the symptoms and worsening their experience and interaction with the symptoms. And so if you can take that anxiety and move it away, that's definitely a great way to help patients achieve better relief or better control of the symptoms, even if you can't provide a true cure.
So one thing that in terms of reducing the stress, right? Getting enough rest.
Absolutely.
The E word, exercise.
Absolutely.
Right? Drinking enough water. So if a person did just those three things, do you think that they could reduce their chance of having IBS?
Again, it's not about reducing your chance of getting the disorder, because again, the disorder is still independent of anxiety. But if you practice these healthy lifestyle habits, you can certainly reduce how much you suffer or the severity of the symptoms from irritable bowel.
Okay.
In addition to the things you said, we often will actually recommend yoga, meditation, and as ways to treat the symptoms, we'll sometimes even recommend acupuncture.
Ooh, needles.
Yes, but again, if you believe in the concepts of acupuncture in terms of trying to help your chakras, the way we translate it in the Western medicine is that most acupuncture sites on the body are essentially areas that have been shown to be nerve bundles. And since I've said that this is a condition of sensitive nerve endings, it does seem to be a way to influence the sensitivity of the nerve endings through acupuncture. And so that is one way that actually works for some people.
So that would, your holistic approach then would be acupuncture, acupressure, meditation, yoga, Pilates, any exercise in general.
Exercise in general, all of those behaviors, and then of course, probiotics will be beneficial to some patients.
Okay. Examples of probiotics that you would recommend?
So they've never studied one probiotic versus another. Okay, so probiotics are under the category of supplements and therefore aren't FDA regulated.
Right.
That being said, some of the more popular probiotics include Align, ALIGN, Digestive Advantage, Digestive Advantage is mostly popular because Dr. Oz has promoted it on his show. But basically, in terms of active ingredients, you get down to acidophilus, lactobacillus, Saccharomyces. These are kind of the most common bacterial strains that you'll look for in your probiotics. But honestly, I think any over-the-counter generic probiotic is great.
Would do the trick.
Probiotics in yogurt, so Greek yogurts and Dannon Activia have more healthy bacteria than yogurts that are not of those two families. And so those, again, will help 20 to 30% of people, not all patients with irritable bowel.
So you mentioned yogurt. I used to eat it, but then now I no longer. I just don't like the taste of it. But now that you're mentioning, we're talking about the probiotics, what would be your advice for how many times to consume yogurt during the week?
Again, so for those people that are sensitive to probiotics, meaning that they've been on probiotics a minimum of 4 to 6 weeks and feel that that is improving their symptoms, and those patients that benefit from probiotics are usually going to be patients where one of their main complaints is bloating or gas.
Yes.
Not as opposed to the abdominal pain issues as much. But if you have someone that's like that and they've given probiotics a try, then really we would be talking about daily consumption of probiotics.
Really?
Either in pill form or in yogurt form. Yeah, because the idea with probiotics is that we're arguing again that the innate bacteria that you currently have in your intestines, this good bacteria that you personally have, if you're having irritable bowel, that there might be some bad interaction that's happening between those bacteria and your personal gut. So the idea of probiotics is that you want to slowly change out the bacteria that you have with the bacteria in the probiotics, which are designed to, in general, be less gas producing and more tolerant to more people. And so if you're going to try to change out this population, you need to be constantly feeding those bacteria in if they're going to have any chance of overtaking your current regime.
Okay, well that makes sense. So Greek yogurt would, on a daily basis, couple teaspoons, tablespoons.
You know, the amount is really up to the person because some people, if they eat too much yogurt, then that's going to do them in too.
Well, yeah, so with moderation. So let's talk about the whole diet thing. Let's pull the onion back more.
Sure.
So what foods do you recommend a person eliminate from their diet? Please don't say red wine. Please, Dr. Greaves, we had this conversation.
No, wine is maybe a heartburn issue, but it's not an irritable bowel issue. In fact, wine has been shown to be slightly beneficial to irritable bowel because it calms down people's stress levels to a degree.
Red wine, right?
Actually, all alcohol in moderation can calm down people's stress levels to a degree.
Yes.
And in moderation can have beneficial effects on irritable bowel symptoms.
But you might get GERD.
You might get some heartburn issues out of it.
I know about that.
In terms of diet, the only universal diet that's been shown in research studies to be a benefit to people with irritable bowel is something called the low FODMAP diet.
And what is that?
So low FODMAP, FODMAP, stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Basically what it means is certain carbohydrates and starches that are found in a variety of foods. And those types of carbohydrates and starches, often our own body can't break them down as well. And therefore, those types of foods are going to get more likely consumed by the bacteria inside of us. When the bacteria consume them, they're going to produce more gas as a result of their own metabolism. That gas is going to lead to bloating. It's going to lead to stretching of the intestines, which can cause pain. And then the pain can trigger contractions of the intestines, which can then lead to diarrhea issues.
So do you recommend gluten-free products?
Well, so gluten or wheat is one of the things on a low FODMAP diet. Fructose-containing things like sodas and so forth.
To eliminate those.
Yes, legumes. Soy, nuts. It's a lot of particular foods. The idea with the low FODMAP diet is that you go on an elimination diet of all of these major categories, and then over time you slowly add back in the food groups to find out which ones are truly bothersome for you, with the idea that hopefully you'll be able to add back. So that's the one diet that has been shown in research to be truly acceptable. Now, I almost never put people on that diet.
I was going to ask that question. How do you, is that your source of treatment?
I usually don't do it because it's such an extreme elimination diet that most people aren't going to stick to it. If people could stick to diets, we wouldn't have the obesity problems we have in this country.
Exactly.
And also, I find that eating is certainly one of my most enjoyable things in life, and I really hate to take food away, especially from the young man or woman that's in high school or college, where eating is not only well for nutritional reasons, but also as a very positive social interaction with
Right.
people, friends, family, etc.
Exactly.
So I really try to get into some of the other more homeopathic ways, or if I'm going to put people on a diet, even if we find that they're not truly gluten allergic, many patients with irritable bowel are gluten sensitive.
Okay.
And so I will start by trying to eliminate dairy and gluten as the most basic things in someone's diet, and
So
and
no,
see how
no
that
cheese,
goes.
no milk, no ice cream.
We start with that for those people
Okay.
that want to prefer a more homeopathic approach. Again, I have many patients that don't want to give up their diet and
Right.
actually
They
would
said, give me a
prefer.
pill. They said, give me a pill, right?
I have patients that are like that, and so I try to keep an open mind for all ends of the spectrum, and I try to keep myself up to date on all ends of the spectrum so that I can custom fit my approach towards each patient.
So, Dr. Greaves, last time we spoke, yes, he is my doctor. Yes, I'm past the age where I need a colonoscopy. You guys can go figure that out. And I do have them on a regular basis. But we talked about IBS, and we also talked about SIBO. What's the relationship between the two?
Sure. So as we've been discussing this whole time, bacteria in our gut tend to be a major contributing factor to the irritable bowel condition.
Right.
And so in the early 2000s, there was a Dr. Mark Pimentel, who is a gastroenterologist. At the time, he was working out of the University of Washington in St. Louis. He's now at Cedars-Sinai in LA.
Okay.
And he started doing research studies where he sent people with irritable bowel conditions for what they call bacterial overgrowth breath tests, which became a small intestinal bacterial overgrowth condition.
So if we hold it up, we have the large intestine going across down, and so the small
Yes.
intestine is in the middle.
That's correct. So when we talk about good bacteria, and all of us, that is usually bacteria that are in the colon.
Okay.
Most of us do not have significant levels of bacteria in the small intestine. His argument, though, was that a substantial portion of patients with irritable bowel do have extra bacteria in the small intestines. And so he started routinely testing his irritable bowel patients for bacterial overgrowth, those patients that primarily had symptoms of bloating and diarrhea.
Okay.
And the argument is that if you have bacteria in the small intestines, because it's in the small intestines where the majority of our digestion takes place,
Right.
if you had bacteria in that area, it would be more likely to interfere with appropriate digestion and absorption of nutrients, and more likely to lead to the bacteria digesting this food and leading to all these symptoms we've been describing.
Right.
So as a result, a lot of patients that have those symptoms, we will send them for a breath test, which is just like it sounds. They come in, they drink a sugar liquid, they breathe into a bag a bunch of times, it gets fed into a cool machine, and it spits out a number. If the number shows that in fact they do have more bacteria than what we consider to be normal, we sometimes will then try to manage that. Now, we manage it most often with antibiotics that bring down that level of bacteria,
Right.
and therefore reduce the amount of gas and symptoms that are going to be produced. And for those people that have a positive breath test, that can be a very effective way of managing the condition. The only problem with that is that when you give antibiotics, the bacteria are eventually going to regrow.
Yeah.
And so other strategies that we've employed, of course, probiotics to maybe not destroy the bacteria but change them out.
Okay.
And a more recent intervention has been something called Enterigam.
And what's that?
Enterigam is labeled as a medical food product. So what it is an antibody that's been purified from cows, and it comes in a powder. And it's essentially a medical protein, meaning medical that you have to get it by prescription.
Right.
And the idea is that if people ingest this protein, this antibody, the antibody is going to try to neutralize the toxins that the bacteria are producing and cancel out the side effects of the bacteria without actually killing them off.
Okay.
So again, it may be a more natural way of eliminating the bacteria's effect on the bowel without bombarding them with antibiotics, which might lead to more long-term harm.
So will that reduce bloating?
The idea is that it does. It sounds great in theory. I do have to say that I've used it a number of times. My clinical results aren't as good as the research trials. Very few people respond to it. Now, people that respond to it, it's a great alternative
How
treatment.
do you ingest it? Is
It's
it
a powder.
pill?
It
It's a
mixes
powder.
in with a
Water,
liquid beverage.
any kind of
Exactly.
liquid. Okay.
And so again, for those people that are interested in holistic options, I've always given it a try. And about 10 to 20% of patients will find that it's helpful. Unfortunately, the majority of patients don't. We
And
don't
how
understand.
Long do your patients do the treatment?
They offer right now free starter kits for gastroenterologists to give to patients, and it's a 2-week initial course. So you start out by taking 2 packets a day, and then for the first week, and then it's 1 packet a day for the second week. If you've started to notice a difference, you then get a prescription from your doctor to continue 1 packet a day indefinitely.
Really?
Well, it's a natural supplement.
Okay.
But again, the idea is that if it works, you're just going to be canceling out the side effects of the bacteria. You're not going to be destroying them, because obviously we worry about what long-term harm antibiotics will do, and whether that's going to lead to resistance to antibiotics when you get a more serious disease in the future, like pneumonia, and all of a sudden,
Right.
you're having other issues.
Yeah, so you might not push that regimen as much then.
The antibiotics, for someone that's severely symptomatic, I will give them, and if it leads to long-term improvement, which I define as 6 months or more,
Right.
then for the right people, it can be a great option, because they can take antibiotics for 2 weeks, and if they get that long a treatment relief, that's almost better than anything else I can currently guarantee. And again, for a lot of people, they would rather do that than potentially be taking a daily supplement or medication.
Right.
On the other hand, if I give antibiotics, and initially it works great, but over time with repeat antibiotics, the effects start coming back quicker and quicker and
Right,
quicker.
yes, they
I
do.
tell the patients, I'm like, look, we have to abandon this course and we have to go into one of these other courses, and that's when we'll introduce some of these other options.
All right, you know what? I'm going to let you take a break, take a sip for a second, but I want you to think about this. 3 tips that you can give the viewers on how to mitigate digestive complications.
So that's a tough category. So
I know.
in
You know I
general,
was going to ask you this.
in general, it's no secret in this country that we're eating the wrong things. We're eating too much of it, and we're eating things that are too fatty, too greasy.
Supersize.
Right. And obviously, I think that has a lot to do with not only irritable bowel, but with the majority of reasons that people see someone like me, including heartburn, irritable bowel, stomach illnesses, and of course the complications from being overweight,
Right.
fatty liver problems, and other issues down the road. If people eat more sensible diets, try to cut away from those fats, try to cut down on some of the caffeine, try to cut back on some of the spicy foods.
So when you say caffeine, coffee, tea with caffeine.
All caffeinated beverages, not so much with irritable bowel, but you asked me general digestive
Yeah.
health.
Yes, I did.
Can cause a lot of people an upset stomach. And again, what used to be a cup of coffee, which was 8 ounces back when we were younger, now is the Starbucks, 16, 22.
Was that the venti?
Yeah, so
Okay.
people will tell me, oh, I have 1 cup of coffee a day, but that's 22 ounces. It's really almost 3 cups of coffee that they're having for their 1 cup a day. So many people are way over consuming caffeine. They're way over consuming, high fructose corn syrups. They're way over consuming, greasy, fatty foods. And I think this is a lot of it. Also, again, a lot of us are living under heightened stress in this area. And I think if you can have an activity, be it exercise, yoga, meditation, a hobby that you enjoy. My wife recently purchased a guitar for me so that I could learn music lessons as a way of my stress relief.
That's how you de-stress.
That's my current stress relief. I think it's important though that everyone have something, and I think if you can control the stress in your life, that'll help. I also think that when you eat, allow time to eat. Thank
I hope
you.
all you guys now are, clear on irritable bowel syndrome.
And if you're not, I practice in Hillsborough.
That's what
I'd
I was
be more
going to
than
say.
happy to
Where
see
can
you.
where can we find you? I know where I can find them, but
Yeah, so we're Digestive Healthcare. We're a group of 7 gastroenterologists currently. We're located in Hillsborough off of Hillcrest
206.
Drive, which is off of 206, right near Dukes Parkway.
Right.
And we have hours Monday through Friday. We have Saturday morning hours. And we're always available to see patients for really any and all GI questions that you have. And they're not going away, you're not sure what to do. Please consider coming and seeing someone like us. We can hopefully help and make it go away in a much shorter time interval than if you wait and try to do it on your own.
And that is true, because I have seen Dr. Greaves a couple times, and he has gotten me straight. So thank you very much again.
Thank you so much for having me.
And I'll probably have you back to talk about something else.
There's a lot of topics.
I know. There's a lot of topics. Yeah, we have a lot to go through on this chart, right?
Yes, and in March, Colon Cancer Awareness Month.
Ooh,
So we
maybe
could
bring
talk
you
about
back.
colonoscopies maybe at that point in March.
Oh yeah, maybe. Or we'll do it before, so then it airs in March. How about that?
That sounds
Got a
great.
deal?
Wonderful.
Okay, good. Until next time, you guys, be blessed, stay healthy. See ya.